to scare you. All right, so sartorius. This is the adductor longus. This over here is pectineus. Okay, that's where we have trouble. Okay, so sartorius, adductor longus. I like to sort of go from the top to the bottom so I don't follow it. This is tensor fascia lata, and this is the iliotibial tract. Okay, so tensor fascia lata, sartorius, adductor longus are these first three ones that you're looking at here. We have the rectus femoris, the vastus lateralis, the vastus medialis. As you go down, still on this, the anterior surface, you can see the gastrocs on either side and the soleus. This is the tibialis anterior. This is extensor digitorum, extensor pollicus longus. This is peroneus or fibularis longus brevis. Okay. Posterior, it's pretty easy. This is the gluteus maximus. This is the adductor magnus. Okay. This is the semitendinosus. It's more tendon down at the bottom. This is the semimembranosus, more muscle down at the bottom, and it's medial. That's how you know those were that. This is the biceps femoris. You cannot see. This is the long head. You cannot see the short head because it's underneath. Did adductor magnus right? Yeah, I did. And iliotibial tract. Gastrocs. So you have a medial and a lateral head of the gastrocs. And that's it for this side. I think we've all gone over everything on here so far. Yep, we've already gone over this. I think the only thing... Oh, yeah, there's an extensor retinaculum, just like there was a retinaculum on the hand. There's a retinaculum here holding the tendons in place. And I did extensor hallucis longus. You guys know that one. Extensor digitorum, extensor hallucis longus, tibialis anterior. And other than that, we are done. All right, deep, nothing. I've already done this. Oh, what I want you to know on this side, the circle. Okay, there's just a couple things to look at here. The one right here, this muscle in here, which is kind of mean, but it's a flexor hallucis longus. Okay, so that's going to be deep. When we pull it out, you can barely see it. It's next to the peroneus. Oh, what I was trying to say, there's something I want to show you. That popliteal nerve. And I expect you to know it. It's circled. Okay? So we'll learn that one. If you notice, what begins to happen, you have a popliteal nerve here, and it goes down, and down here, we call it something else. It's called the tibial nerve. It's the same nerve. Okay, but here it's called popliteal, down here it's called tibial, up here it's called sciatic. All right. Other than that, you have to know we go deep. What you basically have to know is this one. Okay, it's the flexor hallucis longus that we talked about earlier. And you also have to know this one, which is, no, I'm sorry, this one, which is popliteus. Popliteal, popliteus. Okay, so we already did flexor hallucis longus. It's peroneus. Do I have you know this? Yeah, I do. Good. Flexor digitorum. Okay, so you have flexor hallucis longus, flexor digitorum longus, peroneus, deep. Okay? And we've already done this one. Here's what you have to know deep on, and again, you know what, I'm going to come back to this, I'll leave it. Okay, so in terms of the nerves on the front here, go deep and take the sartorius off. That's the femoral nerve. Absolutely expect you to know it. Okay, you pull off the rectus femoris, and that's the only place you're going to see. That gray area is actually a muscle. It's mostly an aponeurosis, but it's a muscle underneath, and that is the vastus intermedius. Okay. Other than that, I don't. Pectineus. Very small. Okay, but he's been looking at it. Dr. Longus, I already told you. Dr. Magnus, I already told you. Oh, I know what I haven't told you. Gracilis. I mean, there's something I haven't said up here. Okay, this is part of the Dr. Magnus. Dr. Pectineus, I got. Oh, Iliopsoas. I'm forgetting. That's why I have to keep looking back and forth. I'm forgetting something. Iliopsoas.
Which one was this one?
Adductor magnus. Okay? So femoral nerve. And we're going to go to, I'm not going to bother with superficial thigh posterior. We already did. Now deep. Pull off our hamstrings. You notice a big old long nerve. Starts here, goes down. Okay? Starts here is the sciatic nerve. Coming all the way down. Here it's the popliteal. Here's the tibial. Okay?
And that's the yellow one, right?
Yeah.
Okay.
Yellow's the nerve, red's arteries, and blue is veins. Okay, so what haven't I shown you? Gluteus medius. I have not shown you piriformis, superior and inferior gemelli, and between them is the obturator internus. So superior gemellus, obturator internus, inferior gemellus, quadratus femoris. Semimembranosus is still here. I think I've shown you everything else. Tract. That's this letter S. Oh! Short head of the biceps, femoris. It shows deep. Okay? And that's it for what I expect you to know. Think.
You have to know the foot? Like the
Nope. Don't like the foot. See, look. Oh, foot. Yeah, there we go. Done. It's so similar to this. There's a flexor digiti minimi. There's a flexor, hallucis minimi. There's a abductor, and it's so similar. And there's lumbricals, just like there are in the hand.
We do need to know the hand, right?
But I only have 13 stations, and there's a lot more things. Rather do the hand and other stuff. All right, this is critical because this is like a $4,000 model, and you will not see it here. But you will see it in a piece of paper. Fair game. Cervical plexus, brachial plexus, thoracic, lumbar plexus, sacral. Absolute fair. Regions of the nervous system. I will not use this. Oh, actually, no, I'm telling people that, and look at that. Look at that. I will use that. You know why? Because of all the cranial nerves on it. That's why I use it. No, they're not marked. Nah, I won't use it. All right, what I will use here, and I expect you guys to look at this very, very carefully. because there's the cervical plexus. From it comes this nerve, which is called the phrenic nerve, which is to the diaphragm. I expect you to know it. Cervical plexus. Brachial plexus, coming out here, creates all the stuff for the arm. Okay, so that's important. Superior, middle, and inferior sympathetic ganglia, which takes sympathetic to the head. And we have spinal nerves coming out here. Then there's all these little ganglia coming down on either side here, the same kind of pink color coming down here. And there are rami, communicantes, coming from the mixed nerve to them. This is sympathetic. Okay, sympathetic motor to glands, smooth muscle. Okay, that's the paravertebral ganglion. Okay, so call them sympathetic ganglion. I call them sympathetic ganglion number 10. I'm not going to ask you the number. I just want you to know, like the rami communicantes is sympathetic ganglion, and that's motor. This looks really scary. It's not. I do expect you to know conus medullaris. I expect you to know filum terminale. I expect you to know cauda equina. I expect you to know lumbar plexus. I expect you to know sacral plexus. I expect you to know the sciatic nerve, number 8, and number 9 on both sides, the femoral nerve. And okay, I don't expect you to know obturator,